In this video, we're going to cover conjunctivitis, also known as red eye or pink eye. We're going to explore the three forms of conjunctivitis: bacterial, viral, and allergic. And if you're a pharmacy student, at the end of this lecture, we'll go through an OSCE exercise. Let's begin by defining conjunctivitis. So conjunctivitis is an inflammation of the conjunctiva, and it's the most common eye condition encountered by community pharmacists. This inflammation can result in redness, itching, discharge, and discomfort in the affected eye, which is why it's characterized by a red or pink eye. Let's briefly look at the main eye structures before we dive into the different types. So we have the eyelids, which serve to protect the eyes from excessive light and as well as foreign objects, while also spreading lubricating secretions across the ocular surface. It's composed of voluntary muscle and includes a thick connective tissue known as the tarsal plate, which provides support and stability. Next is the sclera, which is commonly referred to as the white part of the eye. It wraps around the eyeball and provides structural shape and protection. Composed of dense connective tissue and extends from the optic nerve to the cornea. And the cornea is a transparent dome-shaped structure at the front of the eye that allows light to enter. And of course, we have the iris, which is the colored part of the eye, and it functions to regulate the amount of light entering the eye by adjusting the size of the pupil. So then the pupil is this central circular opening in the iris through which light passes to reach the retina. So then the conjunctiva is a thin transparent membrane that covers the white part of the eye, known as the sclera, and lines the inside of the eyelids. It's composed of the bulbar conjunctiva, which is the covering over your eyeball that protects the white part of the eye, and the palpebral conjunctiva that lines the inner surface of the eyelids. It lines the inside of the eyelid. So these two sections meet at the fornices, forming a continuous sac that facilitates smooth eyelid movement and provides a protective, lubricating layer for the eye. So then, inflammation of the conjunctiva of this structure is known as conjunctivitis, and it can be caused by various factors, including bacterial or viral infections, allergens, or physical irritation. And we can classify conjunctivitis into three main types: bacterial, viral, and allergic. So each type has a different clinical presentations and treatment approaches, which we'll go through in this lecture. So now moving on to prevalence and epidemiology. The exact prevalence of conjunctivitis is not known. It affects both sexes equally and may present at any age. It is more common in children, young children, and older adults. Now, it's generally self-limiting, although viral conjunctivitis can reappear and be recurrent and persistent for many weeks. Okay? So then what causes this condition? So we've got bacterial conjunctivitis. Now, the pathogens could differ between adults and children. In adults, Staphylococcus species are most common. And with viral conjunctivitis, it's usually the adenovirus. And for allergies, it's generally just pollen. Okay, so what we're going to do now is discuss the characteristics of each type, how to differentiate them, and then move on to evidence-based treatments. So now let's subtract complexity and go through the characteristics of bacterial conjunctivitis. So when evaluating conjunctivitis, we're going to consider these five main elements. We have eyes affected, discharge, pain, distribution of redness, and associated symptoms. So number one, eyes affected. With bacterial, it typically starts in one eye and often spreads to the other within 24 to 48 hours. And with discharge, a key feature of bacterial conjunctivitis is the presence of purulent or pus-like discharge. So this discharge is usually thick, yellow, or green and can lead to crusting, okay, particularly upon waking, which is why patients may experience sticky eyes as the discharge causes the eyelids to stick together overnight. Number 3, pain. It's really important to differentiate between discomfort and true eye pain. Conjunctivitis generally causes a gritty or sandy feeling in the eye, so often described as a foreign body sensation, like something's like inside the eye. Whereas true eye pain, which may indicate a more serious condition, is less common with conjunctivitis, which is why it's really important for the patient to describe the sensation carefully. Is it like a gritty feeling, or is it a true pain where it's like stabbing sharp pain? Okay. Now, with distribution of redness, bacterial typically presents with generalized diffuse redness across the conjunctiva. So this redness is everywhere rather than localized, and it often affects both eye once the infection spreads. And there are no other associated symptoms. Okay. So moving on to viral conjunctivitis, both eyes are often affected. The discharge is typically watery rather than pus-like. Patients commonly describe, again, a gritty sensation, as if there is sand in their eyes, and redness is generally diffuse and widespread, so all over rather than localized, and it's frequently associated with other symptoms of a respiratory infection, such as a cold, or cough or flu symptoms. So if a patient reports a recent recovery from a cold or flu or mentions experiencing these symptoms, then it could be viral conjunctivitis. And now we have allergic conjunctivitis. So then this one here, it affects both eyes and is characterized by watery discharge and significant itchiness. The redness, again, is generally diffuse, but is often more pronounced in the fornices, which are the pockets where the eyelid meets the eye. Accompanying symptoms often include a runny nose, sneezing, and a history of allergies or hay fever, indicating an allergic response to an allergen. So this type occurs at different seasons or different times of the year, okay? Now, how can we distinguish between different types of conjunctivitis? Let's look at an overview of these conditions, and again we're going to consider the following 5 elements. We have the eyes affected, discharge, pain, redness, and associated symptoms. So with bacterial conjunctivitis, it typically starts in one eye and often spreads to the other within 24 to 48 hours, and with viral and allergic, it usually affects both eyes simultaneously. With discharge, bacterial, pus-like purulent discharge, and with viral and allergic, watery discharge. With pain, for bacterial and viral conjunctivitis, it causes a gritty or sandy sensation, like that foreign body sensation in the eye, whereas with allergic conjunctivitis, it causes significant itchiness. Again, it's really important to distinguish between that gritty sensation or true eye pain. And with redness, bacterial and viral, it's generalized and diffuse, so it's not localized, it's everywhere. And allergic conjunctivitis, it is generalized, but often more severe in the fornices. Now, with associated symptoms, viral conjunctivitis is often accompanied by symptoms of a respiratory infection, such as cough, cold and flu symptoms. And allergic conjunctivitis associated with rhinitis, so runny nose and sneezing, often with a history of allergies or hay fever. Okay, so in a pharmacy setting, if a patient presents with a red eye, the pharmacist will assess whether the redness is generalized. If not, a referral may be necessary. They will evaluate the level of discomfort, so true eye pain needs a referral, while a gritty feeling can be assessed further. The type of discharge will help differentiate the condition, so purulent discharge suggests bacterial conjunctivitis, watery discharge points to either viral or allergic conjunctivitis. So for watery discharge, the pharmacist will consider seasonal variations and associated symptoms to distinguish between allergic or viral. Okay, and this approach helps effectively differentiate between the 3 types of conjunctivitis. Now, as a pharmacy student, it's important to recognize key referral points for ocular conditions, for eye conditions. So we have accompanying symptoms, any vomiting, any clouding around the cornea, any changes in vision, abnormal pupil reactions or sensitivity to light, so photophobia, any redness resulting from a foreign body or suspected trauma to the eye, even if it's not immediately evident. redness that is confined around the pupil rather than generalized across the eye, sharp or severe eye pain as opposed to a gritty sensation, and any patients who wear contact lenses and present with eye issues should be referred as they may be at increased risk for complications. Okay? So now we are moving on to evidence-based treatments. Starting with bacterial conjunctivitis, it's often self-limiting and may resolve within a few days without treatment. However, antibiotic eye drops can help alleviate symptoms and speed up the recovery. Chloramphenicol eye drops and ointment, so commonly known as Chlorcig, are frequently used to treat bacterial conjunctivitis. These are available as a pharmacist-only medicine, S3. So pharmacist intervention is necessary to, number one, verify the diagnosis, ensure proper use, and provide guidance on dosage instructions. So if you're a pharmacy student watching this, make sure to review the dosage instructions. It's also important to note that patients who wear contact lenses, have undergone laser eye surgery within the past 6 months, or have a family history of blood disorders should avoid using this medication. Now, maintaining good hygiene practices is really important, and children with bacterial conjunctivitis should be excluded from daycare or school until discharge has ceased to prevent the spread of infection. Moving on to viral conjunctivitis, there are no specific non-prescription medications for viral conjunctivitis. The recommended treatment primarily involves using lubricant eye drops, which are also used for dry eyes. These drops can help alleviate the scratchy or gritty sensation commonly associated with viral conjunctivitis. Again, maintaining good hygiene is really important in managing viral conjunctivitis due to its high contagiousness. Unlike bacterial conjunctivitis, though, which generally resolves more quickly, viral conjunctivitis remains contagious for a longer duration, typically until the redness and weeping have subsided, which usually takes about 10 to 12 days. Okay? And to prevent the spread of infection, it's important to avoid sharing towels and to ensure that the tip of eye drop bottles does not come into contact with the eyes to prevent cross-contamination. That's viral conjunctivitis. Let's now discuss allergic conjunctivitis. So the management of allergic conjunctivitis focuses on reducing the effect of histamine on the conjunctiva. But first of all, let's go through what histamine is and what it does. So histamine is a small molecule synthesized from the amino acid histidine. It's produced primarily by basophils and mast cells, basophils in the bloodstream and mast cells in tissues close to the external environment. So we have the skin, lungs, and GI tract. And these cells store histamine in granules and release it in response to allergens. So histamine plays a really important role in allergic reactions. Let's go through this. When an allergen enters the body, histamines are released from mast cells or basophils. It binds to specific receptors on cells, leading to symptoms like itching, swelling, and redness. And there are 4 types of histamine receptors. We have H1, H2, H3, and H4. So here we are going to focus on H1 receptors, which play a role in mediating allergic responses. So H1 receptors are found in various tissues, including smooth muscles, endothelial cells, and the central nervous system. What happens is when histamine binds to these receptors, it causes blood vessels to dilate and become more permeable, which then causes redness and swelling. In the respiratory system, it can cause bronchoconstriction and increased mucus production. And this is where antihistamines come in. Beautiful. Antihistamines, look at this, they are medications that target H1 receptors to alleviate allergic symptoms. So what they're going to do is they're going to bind to the same receptors that histamine target. And so antihistamines prevent histamines from binding and thus block their effects. They're going to block the action of histamines at the receptors. So this is going to help relieve symptoms such as itching, swelling, and redness. Antihistamines are effective in reducing eye redness and itching. Examples include azilastine, keratifin, and levetiracetam. Okay? So those are antihistamines. We also have mast cell stabilizers, and these inhibit the release of They inhibit the release of inflammatory mediators from mast cells and have a delayed onset of action. They are most effective when used before allergy season begins or combined with oral antihistamines. And then we have vasoconstrictors. What they do is they reduce ocular redness and discomfort by constricting the blood vessels around the conjunctiva. However, they shouldn't be used for more than 5 consecutive days to avoid rebound redness. Prolonged use can cause symptoms similar to red eyes. Okay, so that's conjunctivitis, symptoms, how to differentiate them, as well as evidence-based treatments. Now, if you're a pharmacy student, the next part of this lecture will cover specific questions to ask and the overall structure for OSCEs. We're also going to go through an example. Now, just a reminder, this is just a mock scenario. It's not a perfect scenario. You can use it as a guide on what's expected during your OSCEs. Let's go through this. When evaluating a patient with an eye condition, it's really important to take a detailed history to determine whether treatment or a referral is appropriate. Let's go through the questions. First of all, discharge. So we're going to ask if there is any pus or discharge. We're going to note whether the discharge is sticky, purulent, pus-like, or watery. So this can help differentiate between types of conjunctivitis. Number 2, vision changes, asking about any changes in vision, such as halos around objects or loss of vision. Ask if there is sensitivity to light or any irritation to light, so photophobia, which may indicate a more serious condition. Next, assessing the severity and type of discomfort. Is the patient experiencing pain, discomfort, or itching? Gritty eyes could be associated with bacterial conjunctivitis, and itchy eyes generally indicate an allergic reaction. But it's really important to differentiate and distinguish between a gritty sensation and true eye pain. Next, determining where the redness is most prominent. Generalized redness suggests conjunctivitis, while localized redness around the iris or colored part of the eye may indicate a more severe condition that requires referral. Next, duration of symptoms. Minor issues often resolves within a few days, but persistent or worsening symptoms may require further evaluation. Other symptoms, such as recent trauma, vomiting, or signs of upper respiratory tract infections. Consider activities that may have introduced foreign bodies into the eye and any family history of eye disease. Now, what we're going to do is we're going to apply this to an OSCE structure and scenario. Again, this is just a mock scenario. It's not a perfect scenario. Let's go through this. So Jessica Pearson, who is 19 years old, comes in and says she has been waking up with a gritty feeling in both her eyes. She has been having a purulent discharge in both of her eyes, and this morning her eyelids were stuck together. So we're going to go through this step by step. So number 1, introduce yourself and set the scene, okay, understanding the patient's concern. Step number 2, determine the nature of the problem. Clarify who the symptoms are affecting if it's not immediately clear. So asking who is this for, who is experiencing these symptoms. If it is clear, can you please tell me what symptoms you're experiencing? So based on our scenario here, Jessica woke up with a gritty feeling in both her eyes and has been having purulent discharge in both her eyes. So what we're going to do is we're going to go through the specific questions for eye conditions, such as when did this start, and if they have experienced this before or tried anything to treat it. Is there any pus or discharge, okay, pus-like or watery discharge? Is there any pain, gritty sensation, or true eye pain? Are there any changes in vision, any light sensitivity, or any other symptoms? We'll also ask Jessica if she wears contact lenses or has had any eye problems in the past, or maybe has had laser eye surgery in the last 6 months. But in our scenario here, no other symptoms. Step 3, we need to assess if there are any contraindications such as pregnancy, breastfeeding, other medications, disease states, or allergies. Use statements like, to ensure the recommended treatment is safe for you, could you please let me know if you're pregnant, breastfeeding, or taking any other medications, or have any medical conditions? Do you have any known allergies or medical conditions? We can also use universal statements like, some medications may not be suitable for pregnancy or breastfeeding. Do you fall under these categories? It's important to know this because eye drops can be absorbed into the systemic circulation, which could in turn affect the fetus or lactating infant. After gathering information, we should be able to recommend an appropriate product based on patient requirements and preference or refer. Okay, sounds like you have bacterial conjunctivitis. I recommend using chloramphenicol, chlorseed eye drops, or ointment, which can help treat this condition. Next is giving detailed instructions on how to use the recommended product. So explain what they need to do, how to use it, how long the treatment will take to work, and what to do when the symptoms does not improve or worsens. Next is suggesting lifestyle changes that may assist the patient's recovery. So saying avoid sharing towels or personal items and wash your hands frequently to reduce the risk of spreading the infection. And step number 7, concluding the consultation by asking the patients if they have any questions or if anything remains unclear. So hopefully this lecture helps you in your studies. Make sure to subscribe to the channel for more videos.